All right, we'll be looking at some of the very important chest x-rays which every physician should know, okay? The first one is 78-year-old female who is current smoker, presents with complaints of wheezing, productive cough, and breathlessness over worsening over 6 days, okay? So what do you think this is? I don't see any pneumonia. There's no pneumothorax. What I see is flattening of the diaphragm, right? And you see relatively narrow borders of the heart, relatively flattening of the apices of the lung. And then what also you see is superinflation, right? If you count the rib, this is the first one, this is your second one, right? And your third, fourth, fifth, sixth, seven, eight, probably around here nine, super inflated lungs. So this is COPD, predominantly emphysema. And how do you diagnose? You have to get the pulmonary function test. Pulmonary function test will look for FEV1 by FVC, that should be less than 7, and depending on the FEV1 you can further classify COPD as per the GOLD classification. So this is a film of COPD. A 74-year-old male presents with severe respiratory distress and is intubated. So what do you see here? A complete whiteout of the left lung, right? If you notice the trachea here, the trachea is also deviated on the same side. Now, there must be some obstruction around this area which has led to collapse of the left lung. Okay, so this is a film of collapse of the left lung, probably mucus plug. Next one, 64-year-old female who is coming with worsening breathlessness and cough over 2 weeks. A huge, hazy, round infiltrates all over the lungs. This is actually a classic description of cannonball metastasis. Okay, cannonball metastasis. Let's say in the context of USMLE, they might say patient has history of molar pregnancy, is now coming with shortness of breath. Your next step in management is to get a chest X-ray, and you see this. Now this could be, choriocarcinoma, which has metastasized to the lung. This could be some of the vasculitis like granulomatosis with polyangiitis. This could be any GI malignancy like adenocarcinoma or squamous cell carcinoma, which has metastasized to the lung, maybe sarcoma. Okay, so these are cannonball metastasis, and very rarely this may be an exaggerated response in tuberculosis. In tuberculosis, you classically see miliary TB, but if it's very, very severe, you might see similar picture. Okay, so this is cannonball metastasis. Next one, 25-year-old female presents with dyspnea, cough, fever, and night sweats. Now this is miliary TB, right? Here you see fine dots, okay. Now, classically, they don't coalesce with each other, right? So, fine dots, which you see in severely immunocompromised state, that's the classic description of miliary TB. 45-year-old patient who is coming with shortness of breath. What do you think is going on here? It's, of course, a pacemaker, and this is a single lead pacemaker. Now, if you look at the costo-phrenic angle, they are not classically, or they are not predominantly free, or they are not predominantly clear. So this is blunting of costo-phrenic angle, classical of pleural effusion. Okay, here you see bilateral pleural effusion. If you already know that this patient has heart failure, you don't need to tap. But if it's a unilateral pleural effusion, if you want to diagnose what's going on, then of course you have to tap the fluid, and based on the Light's criteria, you have to define whether it's an exudate or transudate. So here you see is pleural effusion. A 50-year-old with chest pain and shortness of breath. So what's going on? Chest pain and shortness of breath. This patient must be very short of breath. Here you see the collapse of lung. This is the border of the lung, right? This area of the lung is complete blackout. This doesn't have any pulmonary vascular markings. So this is a pneumothorax, okay? Now, if it's a tension pneumothorax, you will see trachea pushed to the opposite side. Here the next step in management is what? Needle decompression followed by chest tube placement. A 60-year-old with mild cough and fever. What you see here is bilateral hilar lymphadenopathy. Okay, now it's very easy to say, oh, this could be sarcoidosis, But remember, sarcoidosis is diagnosis of exclusion. You have to rule out any granulomatous disease like tuberculosis or silicosis first before jumping to the diagnosis of sarcoidosis. And you of course have any other supporting labs, like patient would have hypercalcemia and elevated levels of ACE. A 25-year-old with fever and cough. What do you think? There is haziness on the left lower lobe. This is a lobar pneumonia, right? This is a lobar pneumonia in 25-year-old patient. Okay, that was it.